We have a short program today. That is at first that Miriam will present the project SIRENE, and then we give the floor to Joost to present the age-friendly cities and communities questionnaire. Well, after that, we have plenty of room for questions and answers, which we would like to have. So I give the floor now to Miriam, the
Thank
coordinator
you.
of SIRENE.
Thank you very much. I'm not the coordinator, but I support Karina in the coordination of the project. So this is our sixth Science Café, and I think if I see the faces, most of you have already been in a couple of them. The idea is to have short presentation from a specialist in a topic, and then have some time for discussion, really in a cafe style. I'm in my walking desk, so you see it's supposed to be in a short meeting. All the sessions are recorded, and you can watch them back. It's just a short overview. So the SIRENE project is a CSA, Coordination and Support Action, going now towards the end. We'll be finishing October this year. That aims to support the growth of social innovation aggregation systems, delivering eco-friendly and sustainable community-based services for SHAPE. I see for the audience here, we don't need to introduce SHAPE. Project has 6 partners around Europe. With or what are the key, let's say, outputs of the project? We have the social innovation framework with 5 components. And big news, this was approved. Sorry, Sophia, can you mute? I think it comes from you because I hear my echo. Yeah, I think now, is it better? Yeah. It was approved unanimously last Friday. 14 experts approved the components of the deliverable of the framework, sorry, as well as the framework as a whole. And we also have a SIRENE repository with relevant initiatives, projects in this area, and also we provide the means for networking. Of course, as a CSA, we want to encourage a discussion network between experts. So we will. Oh, sorry, Sylvia, I hear me again. I don't know if it's just me, yeah, or if others also. Okay, thank you. We try to provide the tools, the knowledge for everyone who wants to be involved or want to develop, let's say, social innovation initiatives in this area. So we want to inform, build capacity, and connect people. And I promise I'll be very short. It's my last slide. We have this amazing network of 57 experts that most of you are in it. It's always open because we don't want that this finishes with the SIRENE project in October. So we want to keep this as a live community. So if you know anyone that would be interested in joining this network, encourage them to visit the website and register as an expert. So this is the way to get involved. Another way, of course, is to join. You are doing already today our capacity building activities. We have very nice and learning webinars upcoming, and connect with each other. So that's from my side, and now I give the word to the experts because that's much more important than my presentation.
Thank you, Miriam, for the nice introduction. And now I give the floor to Joost van Hoof. He's a professor of urban aging in the Hague University of Applied Sciences. And we work together a lot in the Hague and other projects. But he can tell. The floor is yours, Joost.
So, as you can hear, my voice is not optimal. So sometimes I may mute myself to have a little cough. So that's a warning right from the start. And this is my tryout for next week, actually, because I'm doing a lecture on age-friendly The Hague towards evidence-informed and co-created policy. So that gives away what I'm going to talk about. I think we all know the age-friendly program that was launched in 2007 by the WHO when they published the Global Age-Friendly Cities Guide, which you see here, with the accompanying checklist of essential features of age-friendly cities, which manifest in the 8 domains you see on the right. which can roughly be chopped up in 3 compartments, namely the physical environment, which is normally the domain of engineers, the social environment, which is the domain of social workers and healthcare workers, and then the municipal services. And these of this program has been extremely influential, extremely successful. 3 years after the launch of this program in 2010, the global network of age-friendly cities and communities was established, which has attracted global attention, so to say, global membership. And if you zoom in into Europe, you see that especially Spain, Ireland, and to a lesser extent Portugal, France and Slovenia have been active members, together with Wallonia and Belgium. Poland less so, but it's just quite interesting. You see more and more cities signing up, and when you sign up as a member of the global network, you commit yourself to the 5-year cycle of continuous improvement. That's what it's called, which means that you make plans by involving older people. It's actually part of the job. Then at a town hall is where you do it. Then you implement your plans, and after 5 years, you actually evaluate them. You measure your progress, and you submit a progress report. And based on these findings, you enter a new round of planning, implementation, and evaluation. Well, that sounds quite easy, but my hometown, the town where I work, The Hague, the municipality of The Hague, asked me in 2019, well, we've been a member of this global network since the year 2015, but we actually don't know how age-friendly our city is. Could you measure this, Joost? Could you measure it for us? So how age-friendly is our city? And I was thinking to myself, I really don't know, but let's give it a try. And the white building you see in the back of the photo is actually our town hall. Modern, it's a lot of architects like it, but that's where the people that I work for work. So with that question in mind, I started pondering. So we have 1,500 cities and communities in the world that have joined this network. How do they measure age-friendliness? I simply didn't know at the time. I really didn't know. And I think it's extremely important that we are able to assess the age-friendliness of cities through the lens of older people. So through hearing their voices, hearing their opinions, and not the opinions of significant others, because that's less relevant. So in The Hague, we have a knowledge platform of age-friendly cities, which you see on the photo. I'm standing in the middle. I'm actually standing out. Willeke is on the photo. More people are on this is just a small selection of the people who are involved, but we also have representatives of the older citizens themselves. And together we started this endeavor of measuring age-friendliness. So how do you do this? Well, first I need to share some insights with you. First of all, I truly believe that the lack of measurability of age-friendliness is and was and still is a weakness in moving the agenda of age-friendly cities and communities forward. And if you look at the 5-year cycle, if you don't have any instruments to measure age-friendliness, how can you prescribe a 5-year cycle to all these cities? Because you actually ask them to do something which is impossible to do. And a lot of these cities had this last resort, which was the original checklist of essential features that they used as a menu, but also ticking the boxes like, yes, we fulfilled this criterion. Yes, we fulfilled that criterion. No, we didn't fill that criterion. In the end, we have a score of 5 out of 10. You know how it goes. And then there's also this list of core indicators from the from the World Health Organization, but it doesn't really make a lot of sense to many of these cities. And to make things even worse, this report on core indicators even says something which to me shows a lack of attitude of expressing bold intellectual ambitions. It's just a lack of intellectual ambitions at the WHO. I'm stating this quite firmly, but this is what I believe, and I am free to speak my mind. But they actually wrote this. Age-friendliness is a complex, dynamic, and multidimensional concept. Well, of course it is, because that's how it was conceived, which is also highly context-independent, and it does not easily lend itself to standardization of measurement. That's their way of saying we're not giving it a try. Well, I don't really believe in that, so I said, let's do it better. But there was a consequence. There was not much around. There's still not much around, except for unvalidated lists and indicators. And as a member of the global network, The Hague is a member, this is simply not satisfactory. So what do we have? We have a lot of qualitative methods like citizen science, interviews, focus groups, and they're all useful, don't get me wrong. But we also had a very limited number of incomplete quantitative assessment methods, like Garner and Holland's age-friendly environment assessment tool. But sad to say, it doesn't measure the construct in its entirety. So it measures part of the age-friendliness, not all. We had instruments to measure age-friendly housing, age-friendly neighborhoods, walkability, but it's always a slice of the cake, never the total. So I concluded that we had a great need for transparent, complete, valid, reproducible, and reliable instruments or instrument. So that's what we set out to do. So we used the COSMIN protocol, which was once developed in Amsterdam. It's a protocol that guides you through the development of an instrument that you can use in psychrometrics or clinimetrics. So it stands, it's like a synonymous for scientific rigor in producing instruments. And we were able to produce the Age-Friendly Cities and Communities Questionnaire that we launched in 2020. So a lot of people say, yeah, well, you can just come up with a simple list of questions. That's not difficult to do. Well, you see all these steps here. It's 10 in total. But you set out, and I will summarize this quickly. You set up with a conceptual model, which was the WHO model. You start generating items or potential questions, which you check with experts, which you check with all the people. You do readability testing, and then you start a preliminary survey. Based on these survey outcomes, you do a lot of statistics, a lot of vector analyses. Then you do more inter-skill correlations, and then translations, and you end up with an instrument. So we have a 23-item questionnaire now that can measure the age-friendliness of cities, and you answer it on a 5-point Likert scale, ranging from totally agree to totally disagree with any one of these items or statements. What we found on the way is that we can measure age-friendliness through the 8 domains, but that there was one domain missing from the model of a WHO, which was one's financial security or financial situation, which we added because it's so essential, and I will show you later. You tick the boxes as an older person, and at the back, at the second page, you have a scoring card, and it gives you a score by adding up the numbers, and it expresses the age-friendliness in a number, but also in the form of a traffic light. So people working at a town hall know I'm in the red, so I'm in trouble, or I'm in the green, so I'm good to go, and there's still room for improvement. And this is how the questionnaire came about. And as you can see, the logo of AFEdemy is on there. AFEdemy was one of the lead partners in the development. In the meantime, with a bit of help from AFEdemy, we also managed to be included on the platform of the Decade of Healthy Aging. We have been recognized as a best practice by the European Commission, and we have been recognized as a best practice by the WHO. So we are gaining some attention. What we did in The Hague, we used this tool, and we conducted conducted a survey a survey on the age friendliness with a very large sample of older people. We published on that in Social Science and Medicine and in Cities twice. And if you do these follow-up measurements, we will actually do one later this year in October, which is number 3. You can see the progress over time. And what we found in The Hague is that the mean score for age friendliness was a 7 out of 10. The own home, which is always criticized by politicians, like, oh, people can't age in place because the own home is not suitable. Well, older people think differently and they score their own home very, very highly. We also saw that we had a serious decline in social participation during the COVID-19 pandemic, but we have not seen a real recovery after since. So that's problematic, and that's something the municipality needs to work on and wants to work on. We also saw that older people were less satisfied with the outdoor spaces. It was a meager 6 out of 10, meager, so not even, which is really a bad score for the Netherlands. We also saw that people who use care or care services are more satisfied than non-users about these services. So it shows gratitude on the side of, let's say, patients, you know what I mean. And we also saw something that's really problematic to me personally. It's a deterioration in one's financial position. Over the years, we've seen that people who are having trouble making ends meet face even more problems these days because of inflation, because of all strange government policies. The mean figure for financial situation was a 7 out of 10, but we have a large range. So we have people scoring of 4.6 to 9.4. So you can either be very poor or very rich. And this is something I want to stress once again. In the recent years, we saw 2 groups growing apart. So the people who say, I'm quite affluent, I'm well off, they thought they were even more well off in recent years than years before. Whereas if you said, I can't really make ends meet, you faced more problems in recent times. And this is something I think the municipality needs to work on to be more inclusive from a financial perspective. That brings me to the second story. So who are all these older people? Because if you have everyone as an average number, we're not average. The city of The Hague is very diverse, also in terms of culture. Here you see a group of Hindustani, Surinamese migrants, who are people from Suriname, but they were actually brought there years and years before to work on plantations from India, but they now live in large numbers in my country. So who are the people behind the numbers? So we had a lot of data. So we applied clustering analysis. And what we see is the following. We have 4 large groups that you see, but the only thing you need to look at here are the colors. So in the right column, you see everyone in the green. This is the rich group, the so-called higher echelon. It's 1/6 of the older population in the city of The Hague. Then the third column, it's lighter green, but it's all in the green. It's what we call the average satisfied Dutch citizen. It's about 50% of the population, which is quite good, to be honest. Then we have this other cluster, the first cluster. It's the so-called precariat. People have trouble making ends meet. It's 1/6 of all households with older people. And as you see, they score the lowest on average, because if you have no money, you simply have no money for transportation, for social participation, for healthcare, for anything else, you name it. And then the second category are the people with mobility and disease, or mobility impairments and disease. And they score particularly low on outdoor spaces and buildings and transportation. And that's because they have trouble with accessibility. And it's good to know that people from cluster 3 can easily end up in cluster 1 or 2 if they have a life event, or they become sick, or they lose a spouse, which also means a loss of income. And what we see here are the large differences that are due to socioeconomic factors and health, which is not much of a surprise, but the WHO never made this distinction in any of these papers and documents that they produced. How do I move on? I'm trying to move on. Next. Yep. So these are the clusters once again, with some stock photos from the municipality that I used. But if you look at the group without money, they are likely to be female, and that's because a lot of the older females lack a private pension. So we all have a state pension in our country, but if you have had a career, you get money on top through a private pension scheme. So a lot of women who have not been participating in the labor market, they don't have a private pension, and they are at risk of having a very low personal income. One of them, or 1 out of 4, I must say, 25% of these people are not born inside the country. And that for me is a proxy to say that they may have a migrant status, that they are migrants. We cannot be too sure, because this is a question we cannot ask because of ethics in our country, but it's a proxy, as I said. But I think a lot of migrant older people will actually be in cluster 1. They are also most likely to live alone, 62%. Then it says lower education, 85%, but look at the others, they all have lower education, because in the old days, nobody went to school because it was not normal to go to school. Only in the higher echelon, you find that 26% have had some higher education, but this is something that's quite common in these generations, not to have gone to university or college. If we go back to the first cluster, there's a lot of social housing and a lot of chronic disease, but still they rate their quality of life as 7 out of 10. If you go to the second group, again, likely to be female, less migrants or potential migrants, lot of homeowners, the level of chronic disease is high, not as high as in cluster 1, but here you have a very high use of mobility aids. Then the other 2 groups, which are the average citizen and the higher echelon, not much difference in between males and females or whether they are born. Home ownership is quite high amongst both. It's just a matter of a financial position. And you see that the quality of life is only an 8.4 in the very rich group and a 7 out of 10 in the poor group. So the Dutch seem to be quite modest when they rate their own quality of life. Rest assured, in other European countries, these numbers really stand out much more apart. So I think it's fair to say that we are moderate here. So what's going to happen? So you've seen a bit of what we've been doing in The Hague. We are now working on a new action program with the municipality, which will be launched in the 4th quarter of this year. And we are actually going to develop policy recommendations for each of the clusters that can be used based on non-stigmatizing typologies. So that's been done with the municipality, because we really believe that each of these 4 groups needs specific dedicated solutions, and older people are simply not homogeneous. And this is something that in previous policy documents, including those of the WHO, sort of seems to be forgotten, that we really need to be working towards specific target policies. And not all groups need the same level of support. If you're very healthy and very rich, why should the municipality step in for you? You can fend for yourself. We also see that the rich group from cluster 4 is rather overrepresented in representative bodies, including the Urban Committee for Senior Citizens. I'm quite honest about it, but this is something you see all over the world. And it also means that it's quite difficult to have the voices heard of people who are less affluent. And if you look at these groups, then I think the solutions range from prevention, especially for clusters 3 and 4, to accessibility measures to improve one's accessibility measures for people in cluster 2, and improving the purchase power of cluster 1. In autumn, we are planning co-creation sessions throughout The Hague for drafting the action program together with the older people. So these are the plans. Then I want to walk away from The Hague, walk into Europe, where we still have the City and Co project going on, which tries to co-create sustainable and age-friendly cities together with people from The Hague, from Poland and Romania. So we have 4 cities in this project. It's The Hague, Kraków, Wrocław in Poland, and Bucharest in Romania. It's nice to see that 2 out of them were already age-friendly. Kraków has signed up last year to become age-friendly, and they've now been admitted to the network. And Bucharest is still not active in this field. And what we did in this project is quite a lot, but we also did some cross-cultural validation of the AFCCQ. That means adapting the AFCCQ and translating it for use in Poland and Romania. So we have a Polish version now and a Romanian version. We were quite successful in doing that. But in the meantime, we had Turkey, Japan, Russia, Italy, Macedonia, Israel, Australia, New Zealand, and many, many other countries that all joined the efforts. But these are the countries that I'm showing, which are already done with the validation. But we have a lot of other countries that are all joining these efforts because they are all in need of an instrument. And what we do every time we do surveys, we analyze these surveys whilst we are validating the instrument. We do cluster analyses, and every time we see the impact of one's financial position, so of older people, on how they perceive the age-friendliness of cities. Simply said, if you don't have money, you don't consider your city to be age-friendly, even if it is, because you have no access to services, access to activities, and so on. And this is something that's so important that I keep stressing it. That's proof that we actually have a Japanese version, and I know that Willeke has she posts everything on the WHO's extranet so that partners from other countries have access to all of our resources. What are we doing at the moment? We are also working on photo production so that we are walking with older people through the diverse cities, also in Skopje, also in Adelaide, where we take photos and we geotag these photos with a GPS code, and we plot them on maps. So this is something that I'm currently working on at this very moment. And what I'm also working on is a very large number of video projects. So not all I do is very quantitative, but we're also making a lot of age-friendly documentaries with older people who are their own film producers, so to say, where they do all the editing, all the video collecting, the script writing, and so on. And we launch them on a regular basis every year. And we have a premiere somewhere in a local theater. And it's always a lot of fun to do this with older people. And what we produce are short documentaries, sometimes half an hour, when we have large groups working together. And we use them for political influencing as well. So this is something, it's in a nutshell what I've been doing in The Hague, and that finalizes what I was willing to say today to you and share with you, and then probably there's some room for questions.
Actually, there is. Thank you very much, Joost, for your great overview for what we are doing in The Hague. And in other countries, of course. Sorry to go. Let me give the floor to everyone to make some questions if there are. Please go ahead. You're welcome. Everything was clear to everyone? No, Miriam is asking.
Yeah, I can always ask a question. Thank you. It was really interesting. I'm curious, when you do the translation or adaptation to the different countries, how much do you actually change? Because I can imagine it's not just a translation, language translation. Do you also have the chance to include different questions, or how does it go?
And you are from Portugal, I guess, or not?
Yes. But I
Portugal
lived
was
in the Netherlands for 11 years,
Portugal
so you
was
can compare.
no, but I can use a case from Portugal because
Yeah.
we are working with a group from Coimbra,
Yeah.
and they are still gathering data. But the translation into Portuguese was very easy. It was a literal translation, except for the word welfare. And I was so happy that back then in my team we had a man who's his wife is Portuguese. He's been living in Portugal for over 20 years. And he spent, I think, a week debating the literal translation of welfare or social welfare in the Portuguese context of reimbursement. That was a bit of a surprise, but these discussions happen all the time because the translations need to be very exact with a translation from the English version.
Exactly.
Into Portuguese, and then from Portuguese back into English, and you start comparing them.
Yeah, exactly. But I can imagine not even just that, even beyond the language barriers that or not barriers, but changes, but also in terms of how people socialize, where people socialize. Because, for example, comparing with my experience with in Netherlands, it's very normal to have these groups of through the ball, or groups of people gather much more in groups. While, for example, in Portugal, I think it's something that it's not. So I wonder if it's also possible, or if you encounter that, to, I don't say to add questions, but can the meaning of the questions be changed, or isn't that not possible?
Well, if you have a city without a tram system,
yeah,
then you take the trams out because it makes no sense in that case. But because we based ourselves on the WHO checklist, we took out only the strongest of the strongest items, that were on the checklist, which have less cultural sensitivity. So when we were producing or developing the instrument, we already took out a lot of the weak things that would cause problems with translation or with a cultural interpretation. And if you say individual versus group, those things have actually been filtered out in one of the first stages.
Thank you. Really great.
And exactly for this reason. So the question is good.
Thank you. And we have this recorded and presented also on our website, so we can share it everywhere where we like. So thank you very much again, and see you later.
My pleasure. Bye-bye.
Bye-bye.
Thank you.
Thank you.
See you.
Bye-bye.
Bye-bye.
Thank you.